Many moms will find that when they go back to work, they'll need to give a bottle to their baby. And some moms in the early stages, due to various reasons, may need to bottle feed. Although we don't recommend bottles in the first 4 to 5 weeks, nevertheless, there are times when it's needed. So we would need to know how to best give a baby a bottle. Firstly, try and find a bottle that has a slow flow peristaltic teat. Most bottles are going to advertise that they're BPA free, and so they should be. They definitely should be BPA free. Many bottles are going to say they're orthodontically authorized and they are backed by the best dentists and doctors in the field. A bottle is a bottle. What determines your baby taking a bottle is if they're comfortable with that teat in their mouth. So don't go and buy 6, 10 bottles. Buy one, see how you go. And if it's working well, you can go and buy some more. It becomes a very expensive and frustrating exercise when you buy a lot of one thing and don't use it. Start off with one. Secondly, make sure that that bottle is the correct teat and the correct volume. In other words, the flow of that bottle is correct for the baby's age. If you're looking at a newborn, you want newborn size. 0 to 3, 3 to 6 months, they all have different flows. We don't want a small baby to choke, and we don't want a small baby to be gulping and taking in air and struggling with the feed and being uncomfortable afterwards. So the flow at the bottle is important. Thirdly, when giving a bottle to a newborn baby, we want you to hold your baby close, just like when you're breastfeeding, in the same position. And we would like, because newborns can only see from your breast to your face. This is the length that they can actually see. And they see the outlines. That's why the black and white cutouts are so good. So they're learning about visual perception, they're learning about you and your expressions, and they are also picking up facial cues from very early on. So start off when you give a bottle with making sure that you hold your baby close and that you pace your feeding. We teach paced bottle feeding today because we know that a baby who's given paced bottle feeding would be less likely to overfeed. And one of the big risks of formula feeding is that babies do not have a cutoff. They're at risk of obesity. They're always hungry. We feed them more and more and more because they like it. And let's face it, any baby who's given a teat in their mouth, because the sucking reflex is there, they're going to take it. They do not cut off easily when they're bottle fed. So we have a lot of overweight children as a result of feeding them with the bottle, a whole lot, and then giving them more in one go. So we give a little bit. Let's say, for example, this is just an example. There's 100 mils in the bottle. Maybe give 20, 30 mils and stop. Pick your baby up, maybe wind them or hold them upright, and then you can always put baby this side, the opposite side to where you started. There's a lot of reasons for doing that, and I think it makes sense when you think if a baby's in the same position every time they feed, surely for their body, their neck, their perception, their cognitive, it can't be great. It should be good to move them across. So when you do need to bottle feed, use paced bottle feeding. Take your time, get the right flow, hold the baby close, maintain eye contact, talk to your baby. Communication is key. We don't get clever babies by buying things. We get clever babies by interacting. The most powerful thing you can give your baby is your time, but your intention. So when you're with them, don't be on your phone. Many of my moms have a dip in their supply because they're on their phone while they feed. So whether you're breast or bottle feeding, keep the baby close and make that your special time together, a time of bonding, and not just giving nutrition, but being close and learning from each other. And you are going to have a very content baby, usually. Not guaranteed, but if you do this, you definitely aren't going to have an overweight, unhappy baby.